In this section, we will talk about both confidential and private resources on campus and in the community for our students. A note about confidentiality versus privacy. If you disclose anything to a confidential resource, they are not obligated to report anything that you share to the university. If you talk with a private resource, however, they are a responsible employee and are responsible for reporting to the university. Confidential support available on campus for students during business hours. There's the Student Health Center. The Student Health Center is located between the Blue and Gold Dining Commons and the North Dorm Residence Halls on Olney Ave. They offer confidential medical treatment, certain testing, and exams. The Counseling Center and the Substance Abuse and Violence Education Center are both located in the Medical Office Building, Suite 112. That's the building between Benilde and the LaSalle School of Business. The Counseling Center hosts several licensed professional counselors and psychologists who are confidential resources. And within the SAVE Center, myself, Laura Celia, the Title IX Advocate Educator, and the Director, Kristen Shirley, are both confidential resources. Additionally, on campus, we have Ministry Service and Support. There are two Ministry Service and Support offices on campus. One is in the chapel on the lower level of College Hall, and the other is in the Newman Annex. Only the chapel staff of Ministry Service and Support are considered confidential resources, and they are Father Richard Gross, campus priest, Nina Choi, campus minister, and Brother Robert Kinsler, respondent advocate. A note about Brother Bob. The Title IX Advocate Educator is the designated advocate for complainants when going through the investigation and hearing process. Brother Bob Kinsler and the team of folks that he works with are the designated respondent advocates, so they are folks that reach out to students who are being charged with sexual misconduct. A new initiative that LaSalle has established for after-hours support for students involves working with Women Organized Against Rape. As many of you may know, WAR has been active in the Philadelphia community for years around support and advocacy for sexual assault survivors, and they do a lot of education and prevention within the Philadelphia community. They have a 24-hour confidential hotline that students can call at any time. In the event that an individual calls and identifies him or herself as a LaSalle student, the WAR counselor on the other end of the phone will share LaSalle's resources, both confidential and private, with that student, and refer the student to the Title IX Advocate Educator for on-campus support. WAR will not contact the Title IX Advocate Educator and give the name of the student that called. The counselor will simply report to the student that he or she may access those resources on campus. Additionally, if a student calls WAR after hours and would like an escort to go to the Special Victims Unit to receive either a SANE exam or to begin pressing charges, WAR will send a counselor to LaSalle's campus to escort the student via public safety to the Special Victims Unit.
Private support resources for students are the Deputy Title IX Coordinator, Dr. Dawn Souflaris, located in Office 123 of the Union Building. The Residence Life and Community Development staff, including the Assistant Vice President for Residence Life and Community Development, the Director of Student Conduct, and the Executive Director of Residence Life and Community Development. You can also contact me, Jim Kalovic, the Assistant Director for Investigations, in the Public Safety Building. And of course, you are a private resource for students as well. As a responsible employee, quite often, you are the first person to whom someone discloses sexual violence. So what questions should you ask?
If a student discloses that they were a survivor of sexual violence, things that you might consider asking revolve around personal safety, medical attention, and other basic information. So if a student says that he or she was assaulted maybe the night before their conversation with you or over the weekend, you can check in and see if they need medical attention, and you can make a referral to the Student Health Center or offer to walk them over. With regard to personal safety, if the student discloses that they were assaulted here on campus, you can ask them if they feel safe walking around campus, if they feel safe in their residence hall, and you can make a referral to public safety. Basic information, sometimes when students experience trauma, they forget to take care of their basic needs. Checking in with the student to ask if he or she has eaten yet today, or if he or she has slept the night before, then those questions can make all the difference in the world.
So what questions shouldn't you ask?
Questions to avoid asking students who disclose sexual violence involve detailed questions about the incident. We have investigators and public safety officials and also advocates who will ask those tough questions and ask the student to disclose as a means for an investigation or to help processing. So you want to avoid asking detailed questions about an event that happened. If the student chooses to share that information with you, that is his or her choice to do so, but you should not feel the need to investigate the situation on your own. Other questions or things to avoid talking about include questions that could be considered victim blaming, asking the student how much he or she had to drink the night before, asking the student what he or she was wearing, why he or she chose to be in that particular campus house or that location in the city. We want to be careful that we are not making students feel like they are being blamed for what happened. And so even though your internal monologue may have these questions, it is not appropriate to talk with students about them.
As a responsible employee, we also are charged with writing the incident report. We want to include all the information that is provided to us in as much detail as possible. And we want to submit that information, that report, in a timely manner so the incident can be investigated and the resources and needs can be met of the complainant.
We talked about questions to ask and not to ask, things to consider saying and what to avoid saying to students. You can tell students when they disclose to you sexual violence, this will be kept private. Remember, you are not a confidential resource, so you are responsible for reporting information to other officials at the university, but that information is going to be kept within a small circle of people and on a need-to-know basis. You can tell students this is not your fault, you did not deserve this, I am here to support you. Additionally, you can share with them that they have the power to decide what happens next. At times, this is a little bit complicated because with them disclosing information to you, you are obligated as a responsible employee to make a report. However, once that report is submitted and that person has an opportunity to meet with an advocate or with Dr. Dawn Souflaris, that student will receive a list of options. And he or she can decide what options that they would like to take part in. They are not obligated to go to the counseling center. They are not obligated to receive support from Student Health Center. They are also not obligated to participate in an investigation in the event that the university needs to move forward with one. So it seems like by having to share this information that a student has trusted you with, that you are taking the power away from them. But what actually happens is that they are presented with opportunities and they have the option to decide what they would like to do. Thinking about what to avoid. We mentioned this in the slide before. Feeling the need to investigate further. Again, unless the student is very forthright with you, please do not ask any additional questions. They are going to have to tell their story again, and so if they can avoid one person that knows all of the details and is asking them questions, that's going to be very helpful. Victim blaming, again, were you drinking? Why were you still dating that person? Are you sure this is happening to you? Those are questions that you need to avoid, absolutely. And the bullet at the bottom here, feeling the need to have all the answers. It is okay to tell a student, you know what, I don't know what's going to happen next. You're going to refer that student in writing that incident report that you're going to submit to the Deputy Title IX Coordinator and to the Title IX Advocate. And those folks, sometimes we don't have all of the answers and we have to do some research and make some phone calls. So if you don't know an answer to a question, don't make one up. Just tell the student, you know what, I'm not sure, but I will refer you to someone who may be able to help you a bit better. As a responsible employee, in addition to things that we would like you to say and what to avoid saying to students, there are things that we can encourage you to do and not to do as responsible employees. We've mentioned some of these things throughout our presentation. This is more just a review as we wrap up our time together. What you can do is offer to walk the student over to a confidential or private support service. If the student isn't familiar with where the medical office building Suite 112 is, or they're not quite sure how to access the Student Health Center, you can absolutely, if you have time in your schedule, walk the student over to those areas. If you feel comfortable, you could also accompany the student in a meeting with a support person. The Title IX Advocate Educator, myself, I have had conversations with professors and students where the professor and I work to build rapport with the student and then the professor leaves so that additional conversation can be had. If you also feel so inclined, you could act as a support person in an administrative hearing setting for a student. So if a student who is going through the process says, you know, I have been accused of violating the sexual misconduct policy, you and I have a very good relationship, I'm wondering if you would act as my support person. Those folks who are accused of violating policy need support too, and if you feel like you could do that, that is certainly within your bounds as a responsible employee. The biggest thing that we'd like for you to remember about what not to do as a responsible employee involves keeping information to yourself. One, we don't want you to keep information to yourself out of fear that it will change your relationship with the student or it will put your job in jeopardy. Actually, the opposite is true. If you do not report information that you know, that could result in job action. So we need you to take advantage of using an incident report system and share all of the information that you know with us. In addition to that, we are asking and strongly encouraging that you do not share something that a student has shared with you regarding sexual violence with anyone else, except for going through the reporting process that was explained a little bit earlier in our presentation. It is very important that we respect the dignity of the students who are involved in these situations, and we let them have the choice of who they would like to disclose information to. So even though you feel like you might be helpful with letting the rest of the team members or coaches know that so-and-so is having a rough time, or letting other folks in your academic department know that a student is struggling academically, while you feel that may be helpful, that is actually taking power away from the student, and it is a little bit problematic as we move forward with investigations. So please keep that in mind as students disclose to you and you go through the reporting process. In terms of being a good source of support, this is a review. We want you to be very honest and direct. You can still do those things with compassion. It's important that you also take care of yourself. Know your limits. If sexual violence is something that is not comfortable for you to talk about, it's okay for you to say to a student, you know what, I want to make sure that you get the help that you need, so let's take a walk over to the counseling center. Don't get in too deep, and make sure that you have someone to lean on. The Title IX Advocate Educator is always available for confidential consultation, but also know that you have people in your personal lives outside of LaSalle that you can share with and process with if you need to do so. Remember that you will not always be able to immediately fix the problem, but that by being there as a source of support, it can help a student heal. It's also important to remember to embrace the discomfort. These are not easy conversations for our students or us, and that is okay. It's part of the job that we take on a little bit of that burden and that discomfort so that our students can heal and be successful students while they are with us at LaSalle.